I think we are live. Hi, everybody. I am really excited for you to join myself, Bailey Schneider, and Dr. Maraschin. We are going to be talking all about developmental milestones in babies. And we tried this a few weeks ago. We had some technical difficulties. So I'm really happy that you guys are able to join us again and that we'll hopefully be able to have this chat. There is Dr. Maraschin now. See everybody. Hi, Megs. Just going to wait for him to come in. It's busy connecting.
Ah,
Yay!
here we go. How you doing, baby?
How are you doing?
Hey, yeah, we're sickling under the COVID stress, but yeah, lots of nice babies to look after and, keeping them happy, keeping them healthy, which is what we aim for.
Well, I wanted to introduce you. For people who don't know, you are a pediatrician at the Morningside Clinic. You've had your private practice for over 25 years. And I mean, your aim really is just to keep children healthy. You look after a lot of premature babies. Most recently, you found a need to assist parents with children with learning disabilities, especially ADHD. And, you play a huge role in our children's fundamental years.
Yes, as a young pediatrician, you start off with the obstetricians referring all the small babies and the prem babies. And, then we have the privilege of watching them grow up much like a parent does, and it's actually very satisfying to see the children molding into who they are. And I think that's really where we're at. Firstly, we want to keep them out of hospital. We want to keep them healthy. And, we have programs. The most important would probably be our vaccination programs. But it's just nice to see them developing and growing. And the other thing I like to emphasize is that you got to let your child grow into who they are. You can try and mold them the way you want to. It's not going to happen. And if you do that, they'll probably not follow that pathway anyway. Long term, they're going to become who they are. And that's what we
Sure.
aim for.
Well, it's so interesting because when I was talking about, that we were going to be having this chat and that I was going to be talking to you, I mean, I hope you know how loved and appreciated you are because I got inundated with DMs from people going, we love Dr. Maraschin. We love him. He was my child's pediatrician. My child's 21 now, and whatever the case is. And I mean, that's such a true testament to you. So congratulations for that.
Yeah, and we love being part of that journey. For us, it's all about the journey, and yeah, so we like being part of the parents' journey.
Well, for those of you who don't know me, sorry, I didn't even introduce myself. I'm Bailey Schneider. I'm a radio presenter on Smile 90.4 FM, and I'm in the thick of it with two babies. I have a 3-year-old and I have an 8-month-old. So I'm really excited to talk to you today, Dr. Maraschin, about baby developmental milestones. What are the key milestones that we can expect from a baby at, let's say, 3 months?
So look, yeah, development is that baby coming into its own. So the kids are born with their little senses. They've got the sense of touch, sight, smell, taste, and hearing, and they start off amorphous, and they grow into the features that we said that who they are. So,
Okay.
I mean, to start with, development doesn't only really start at 3 months. So at 3 months, baby's going to learn to put their hands in their mouth. They're going to start doing a bit of tummy time. They may even start learning how they want to roll and move from side to side and start responding to sound, and start to more cognitively noticing things around them and, noticing colors, listening to sounds, responding to the mother's stimuli. But development starts in the uterus, so we need ideal non-stressful circumstances for mothers so that when the baby is in utero, the development happens normally. And then when they're born, the biggest thing is to stimulate and keep everything positive and happy and healthy. And so when the babies are born, the major development is that they learn to suckle on their mother's breast and they learn to feed. And from there, all the other development then progresses. And so it starts off with the cuddling mom, feeling mom, the nice warmth of mom, the cuddling, the rocking. I've just recently come across an article that says that rocking a child is important because for their long-term development. And, moms instinctively do that. I had a mom here this morning doing a 6-week checkup, and she's sitting there rocking, but she doesn't even know she's doing it. And yet it's a critical part of the development is that rocking, okay? And then through that, then the child starts to discover what's going on around it with those senses, the touch, the sight, the smell, the hearing and taste. Which obviously the taste starts with breast milk and then will progress later when we start with the solids at 4 months. So, by the time you get to 3 months, this kid's quite interactive. It's laughing if you humor it. It's following you wherever you walk. It responds to your sounds. It tries to imitate your sounds. It puts its hands in its mouth, and then when it's discovered its hands, it uses its hands to discover the rest of its body. And once the things they can't touch, so then they grab their feet, they put their feet in their mouth. So those are the types of things that are going to happen at around 3 months. And then that all progresses and they discover their little world around them.
Yeah, they go from little newborn lumps to suddenly going, hang on a second, I'm now out of the womb. And just in terms of the rocking, I found myself socially distanced in a grocery queue the other day, and I was rocking backwards and forwards, and I didn't even have my baby with me. And so it's so instinctual just to rock.
It's just myself. It's just automatic. And the dads are saying, you're spoiling this child, and this child's going to get used to being rocked all the time, and now you're going to have to do it for the rest of your life. But I was one of those dads, I must admit. And yet it's a very important developmental milestone, and I just found that so interesting.
Yeah. So, all right, so 3 months, they're starting to awaken up, they're starting to discover themselves. What can we expect at 6 months?
Yeah, so gradually they start getting more mobile, and between 3 to 4 months, they start discovering how am I going to get my body rolled over from front to back or back to front. And they figure it out, they've got to learn to tuck the one hand in and the other arm over and learn to flick themselves over. Then coming into 6 months in that process, they also start learning to sit. And then, through stimuli, the baby gym's a great one for a 3-monther. They start learning to touch things and feel things and hear things. Big one would, the important thing for a mom to do is and moms do this instinctively as well. They talk to their babies continuously. If you observe a mother, she does that instinctively. Talking, telling, and that's all language development. It's all happening very dynamically, And then by 6 months, a kid learns to sit. It might even, because it's been using its hands now, it learns to transfer an object from hand to hand. It learns to follow and track wherever the mother is. It's responding to sounds. It may enjoy listening to music, may enjoy listening to words, songs that mom might sing and language. And so all those senses are all being used all the time to just program this little sponge, that is absorbing information. And you said earlier, you watch these little amorphous creatures, but in 12 months flat, that amorphous creature is going to be walking around, and it's going to be the boss of the family. It can instruct everybody in the family. Isn't it an amazing process? To sit there and observe this thing from nothing to controlling the whole family just in 12 months.
It is. It's quite something to watch someone in their whole new world, discover a whole new world, be able to do things that we take for granted, like sit up, crawl, whatever the case is. So do boys and girls develop differently?
Generally, in the first year of life, there isn't any big difference. When the kids go into puberty, then things might be a bit different, because the girls do tend to develop a little bit quicker than the boys, and then the boys catch up. And girls go into puberty quicker than boys. But in the early years, it's much of a muchness. But I think what moms must also hear is that, everybody develops at a different rate. So you might have, I had a little child who walked into my rooms, walked in through the door behind me here, at 6.5 months, walked into my rooms and looked into my eyes and said, "Ayo." In other words, was trying to tell me hello. I mean, how phenomenal is that? But not every child achieves that. And I've got a parent that came to my practice, and she only walked at 18 months, 2 years, and yet she was a Springbok swimmer. So there's a wide variation of normality. I mean, obviously, if you see that every other person's kid's doing something that your kid's not doing, then you must be alerted and say, look, maybe there's a problem. Then, you consult a healthcare professional in that line.
Well, that's what I want to ask, because, as parents and a lot of us first timers, and even if we're onto our second or third child, I swear we forget. There are times that I'm like, what age did my first son start crawling? And so, I mean, I've forgotten everything. I really need to write it down, and moms, write it down, because it's amazing what porridge brain does. But, when should we start worrying about our baby's developmental signs?
Yeah, so I think in the first year, if you see that that there's a maybe 6 week to 3 month lag or delay, then you can consult a professional. It can be perfectly normal. There may not be any problem, but just don't ignore it. I found one thing in pediatrics is the earlier you intervene, the quicker things come right, and the easier it'll be to remediate problems. I find the parents, if you're going to a little bit of denial and hang on while we'll wait a year or two, that year or two you've wasted. So if there were a little something you could do, let's do it earlier than later, because if you do it early, it's a little thing you have to do, whereas if you wait till later, it might be a big intervention, and that can be an issue.
So I think rather safer than sorry. Don't worry about being, because I think you know what it is. A lot of us moms go, oh, I don't want to be that mom. I don't want to run to the doctor for every little niggle, every little concern. But we've been given a beautiful gift of mother's intuition. And sometimes we ignore it because we're like, well, I feel this, let me Google. We are terrible with that. There's almost too much information. So I think it's going back to basics. If you fundamentally feel that there is something wrong, even if you feel like you're being stupid, so what? Rather go to the doctor, find out about it, and be told by you, for example, your baby's fine. Great. Happiness. Or, I mean, imagine like finding out, actually, you know what, you can do X, Y, and Z, and you can correct something. So I think that's it. It's figuring out our maternal instinct, and safe than sorry, rather be that mom who goes to the doctor.
I mean, one doesn't want to be the paranoid parent, and I think being a doctor parent or pediatrician parent, that's where I was, and I think your two summaries are correct. If you go to the doctor and he reassures you, well, firstly, you can stop worrying, and secondly, if he doesn't reassure you and there's a problem, well, let's deal with it. Let's get it done and sort it out, because the sooner you sort it out, the less trouble you'll have later. But I found with my son, for example, he would give you exactly what the problem was. And it was amazing how a little child can actually interpret their own little symptoms and tell you exactly what the problem is. Obviously not in the first year of life, but later in life, and so firstly, trust the child. And secondly, trust the mother instinct. And look, the mother-child thing is a big diode, and they tell us the dads have to learn to break into the diode to make it a triode, so they're also part of the team. So don't ignore the dad's concerns. And it's such a nice thing. I mean, I've been in practice 25 years. It's so nice to see the dads getting involved with the babies, and that's also important, because if both parents are involved, it just makes a better team, and it makes a better product at the end of the day. And trust those instincts. At worst, if you go and consult a health professional and there was no problem, well, firstly, there isn't a problem. You might have wasted a bit of money. That doesn't matter. We spend so much money on our kids anyway. It doesn't really matter to know that they're fine.
It's so true.
That's something you learn in the first year of age, isn't it? Just how much money it takes.
That's a whole other topic. Oh my goodness.
Yeah, that's a
I'm
separate
seeing a whole bunch of questions here, and we've got a couple of questions from people that have been sending through. But the one thing that is coming up quite a bit is how frustrating it is when people compare other babies with milestones. And I think, how do we stop comparing our children to other children, and even amongst siblings?
Yes, look, every child is individual and everyone's going to develop at their own rate, but there are times where there is a problem. And look, I mean, I often ask the parents, I say, look, did the teacher notice if there's a problem? Because the teacher has the benefit of like 30 kids in front of them, maybe in this age group, certainly not 30, but 5 or 6 kids in front of them. And if there is a difference, well, address it. So comparison's not a bad thing, but let's not get neurotic about it, Let's just be reasonable. I mean, if your kid's not walking by 18 months, 2 years, there are families who have kids who only walk at 18 months, 2 years, and that's normal, providing everything else is normal. Right. But if it's not normal, if everyone else in the family walked at 9 months and this kid's not walking yet at 18 months, maybe it's time to sort of perk up and think that there's something we need to do about it.
Bianca has asked, does modern cloth nappies hinder milestones, crawling, walking in any way?
Look, I mean, a bulky nappy may be a problem because there's more gap between the legs. But look, in past centuries there were only cloth nappies, and
right.
I don't think that was a problem. And in fact, early on, it might be good for hips. So, for example, if we're treating a child who has a dislocated hip at birth, we want the limbs to be wide apart and sort of in that frog position. So early on, that might be an advantage. But as the kid gets more mobile, look, I've never personally come across a child who was brought up with cloth nappies and that's had a problem with it. I haven't come across it. Yeah.
Awesome. So can you share on any ways that we can promote our babies' developmental milestones?
So I think if we think of all those senses that I've said, mentioned, and we try and work on all of those, and you don't have to go and buy a big, expensive developmental program. I mean, if that's what floats your boat and works for you and you want to do it, it's good. But as long as you start interacting, so the most important component of how the child's going to develop is the fact that the parents are there interacting with the child and stimulating all those senses. So the touch would be, hugging, loving, kissing, and I mean, under these COVID circumstances at the moment, I've got a big problem because now the kids haven't met their grandparents, they haven't hugged their grandparents, they aren't meeting other people, they aren't, socializing.
And they're only seeing this.
Yes. Yeah. Luckily at home they can take the masks off, but when you're out, that's changed. Unfortunately, hopefully it'll change back for the better later. But then also, visual things, so have lots of colorful things. We had these bright, it was like a jungle background curtain with parrots on it for our son. I loved it, and so did my son, and the whole family enjoyed those curtains. And it's a stimulus, And then with the hearing, talking to your child, I must say mothers are incredible that way. They are talking to them all the time. And that's language development, because if they're not talking to them, they don't learn. And they don't only learn language through hearing. The funny thing is, when you're talking to a child, the best thing is to look in their eyes, because they watch how you move your mouth. And that they imitate how you move your mouth, and that's how they learn to form words. And then the other senses, I mean, the music for hearing, nice sense in the house. Later on, when you're introducing foodstuffs, introduce lots of variety of lots of flavors. Let's not keep it bland. The one thing we don't want you to do is add too much salt, because that's not good for your health, and to keep away from the sugars. But give lots of nice flavors, and fresh stuff and natural stuff. And I mean, that's also part of development. And then we might come to the environment. What do we put in the environment for these kids? So when they're small, You know, it might just be a little rattle, or these little bangles that you put on them with a little rattle on it that makes a noise, and then they start interacting with their baby gym. You know, that's a great developmental toy. Or the mat that's under the baby gym that's got all the different textures. And importantly at that age, it's also the tummy time. But, you know, I mean, if I lie you on your tummy, you know, somewhere, you know, you're not going to be so excited. But if I put a whole lot of interesting things in front of you, and they don't have to be big, expensive or whatever, but things that you can play with in front of you, then tummy time becomes a lot more exciting, you know.
Well, I wanted to talk about tummy time because we've got quite a few messages, and I'm sorry that I can't go back to all your names. But a lot of people going, my baby hates tummy time. So
Yeah,
what can we do to start getting them used to it? Because obviously tummy time is quite important. So sorry, I'm throwing a whole bunch of questions at you. Let's break it down. Why is tummy time so important, firstly? And secondly, how can we make our babies love it? There we go.
Look, there are two types of kids that I find really battle with tummy time. And the first one is kids who've got a lot of gastroesophageal reflux because it's uncomfortable for them and it's not pleasant for them, and it causes them discomfort. And in fact, my entire family, we all seem to battle with reflux and we don't do tummy time, which is not great for development. Yeah. And the other ones are the sensory defensive kids. They just, I remember even at the age of 5 or 6, I couldn't tolerate tummy time, even on my dad's lap, you know. So I think carrying techniques is where the tummy time starts. And if you see a mom walking through, often we carry them on our left arm. So they'll just use this little teddy bear to show where the baby is. And you know, we usually do on the left or the right, depending on whether you're left-handed or right-handed. But let's not forget to move the baby to the other side so it learns to look around from a different perspective, okay? And then tummy time can even start when you're holding them. So say you've got a baby who's got a lot of reflux. You could start tummy time in your arm. So you just flip the baby over like this. You put your hand through holding the baby by the body, like that. And if you're not confident with one hand, you can use 2 hands. But if you do have babies firm like that, you can use your other hand to do things. Because, you know, moms are forever multitasking or 100 things. Very few people get just how many things moms have to get done. And then don't forget to swap over the other arm, you know, so you can do it this way. And some other parents prefer it this way, where you grab them under the nappy. So if you've got a kid who's got reflux, can you see we're still upright, but we're still doing our thing. And then you can also just put them on your lap. We'll just pretend my arm's lap because the camera's not going to show you that. You can just put them over your lap that way or that way or that way, so that they're actually lying on you to get tummy time ready early on, you know, so they get used to it. And then once you've got that right, then you put them on the floor, and then in front of them here, you can have all those exciting toys. Don't have to be expensive. I mean, even things like plastic containers from your kitchen, you know, plastic toys that you put in the bath. So that's another important one. You know, we have the baby gym for the dry on the ground to learn, but in the bath, there's lots of little toys you can throw in there. And I think just regarding toys is a very important point I want to make, because it is critical, is, you know, you've got to have child-friendly and child-safe toys. And I just came across an article that says if you've got your toilet roll, if your toy can fit through the toilet roll, it's too small, and that can be a choking hazard. So it's easy, you know, how easy is that? You just put your toilet roll, if it fits through there, the choke on it. Simple. Hey, such a little trick
that's very clever.
Your kids play. Yeah, I like that concept.
That's fantastic. So I'm trying to get through as many questions as we can, because, you know, you are our little sponge for us to squeeze all your information out of, Doc. So thank you. Alex here says, yes, my twins are 7 months and not crawling yet. They don't sit on their own, only supported by cushions. They are rolling. Should I be worried that they are not sitting on their own? And they're 7 months.
So 7 months, they're starting to do these things, and it may just be one of these kids that might develop fractionally slower. The average for sitting is 6 months, but that would be supported. It won't be full-on sitting, you know. So if a child is sitting supported maybe by 7 months, it's not so bad. It's not too bad, but you've got to keep an eye on it. So I'd say over the next 2 to 4 weeks, if there's no progression and things aren't getting better, then you might start worrying about that. So regarding the rolling, I find there are a couple of scenarios of how they do it. So some kids learn to sit at 6 months, then they roll them one way and then learn to roll the other way. Other kids will learn to roll one way, then sit, then roll the other way. And yet others will learn to roll both ways, then learn to sit, and then, you know, move on from that. Okay. So I think that the kid's rolling and getting around and moving its body, and you're not quite at the sitting yet, keep an eye on it. And I'd say over the next 2 to 4 weeks, if there's a problem, then it might be time to consult a healthcare professional in that regard.
Okay. Getting a lot of questions also about crawling. When should babies be crawling? How do we train them to crawl? Because I was thinking about it the other day. You talk about children mimicking. Well, we don't see a lot of people crawling around. You know, you can see a lot of people walking around. You don't see people necessarily crawling. So is there something that we could teach them? And what age should they be crawling by?
So look, your point about we're not crawling, well, maybe it's time we do start crawling. So if we all get a little bit fitter and a little bit more supple and do a bit more stretching, which is good for our health, we will be able to get down to the hands and knees where our babies are, because that will assist our babies, because we'll be interacting with them on that level. So sometimes, you know, we've got to get down to the kids' level. And so I would encourage people to get on hands and knees, get on the floor, play with the kids, you know, get yourself a little bit fitter. Unfortunately, sometimes moms are so busy, there's no time to get to the gym or get fit, but maybe a little program at home. Luckily, everything's on our phone nowadays. You can have a quick fitness program for 15 minutes, so you can do that. Then, the tummy time is the start of getting the kids, firstly, to learn to roll. So that it will be rolling, then sitting, and then crawling. And crawling, the average is about 9 months. But, you know, there'll be kids who'll crawl long before 9 months. I've even had 6.5-month kids that I've just mentioned that can even walk. But that's not the average. The average is about 9 months. And by a year, you'd like to see the kid starting to crawl. If it's not happening, then once again, get it checked out. If there's no problem, fine. If there is a problem, let's sort it out. I found that, so my kids, we were trying to sort of get them to, my daughter was an ex-prem, you know, and so she was 9 months, but she was actually really 8 weeks younger than 9 months. And we had a bit of physio, and she had a whole lot of high tone, and oh goodness, you know, all the things that parents don't want. And we were told to put a towel under the baby's tummy and try and encourage it. But I find, you know, when a kid's ready to crawl, they'll do it. And look, I've got kids who just never crawl. I've got a kid, you know, just got up and walked at 9 months and refused to crawl.
Wow.
And it wouldn't, you know.
Oh no, I'm not ready for that.
Yeah, the problem
Push them back over.
when they start walking, they get into every cupboard in your house, and you got to be awake and sharp and keeping them safe. And there's a lot of hard work. So what we were saying about earlier, give yourself 5 to 10 minutes to get onto your phone, and even if it's just a few stretches and walk up and down the stairs or nice walk in the garden, keep yourself a little bit supple, because moms forget about themselves, you know, and the kid can't develop properly if the mother forgets about herself. You know, it's no use if a mom at 6 or 8 months collapses in a heap, exhausted, postnatal depression, not able to cope. So mothers do have to also look after themselves, and that will help them to interact and be able to do things with their kids. I think that's another thing. You know, I'm very passionate about parents doing things with their kids, you know. So don't wait till next year to do something, you know. If you can take them to go and do something do it in the next week or two, you know, and things don't have to be expensive. Honestly, you can go to an art museum, you can go to a park, you can go for a walk, you know, you can, you know, take your dog for a walk, play with a dog, play with a cat, you know, interact with everything that is around you.
Fantastic. I'm going to get to some more questions that are coming through. There's one that says, my 22-month-old isn't talking yet. She only says one word. Should I be concerned?
So I say that would be a definite to go and see a pediatrician. I mean, it could be a simple, I had the one kid arrived and it was exactly the same story. And the kid's ears were just impacted with wax, and we took the wax out, and within 2 or 3 weeks, it's amazing how kids suddenly develop because they're hearing properly. And then there was the common one. We used to have a lot bigger problem with ear infections previously before we started doing the pneumococcal vaccine. And since we've done the pneumococcal vaccine, we have a lot less problems like that. But fluid behind the eardrum might be a problem. And it can be, I mean, it can be easy as treating it medically, or there are kids who have, you know, such severe problems that you actually have to get them to the ear, nose and throat surgeon and put a set of grommets in. If those two common things aren't there, then, you know, you may need a formal hearing test. You may need an ear, nose and throat specialist to look at it. You might need special testing. So there's, you know, simple tests that we can do in the rooms. The ENTs have got machinery to test hearing in the rooms. And yet, if it's not great, there are even more sophisticated tests. So I think at this stage, if your baby's not talking, we've got to test the hearing first, sort that out. And if that's not a problem, then, you know, it gets a little bit more complicated, and your pediatricians and your ENTs would have to sort that out.
Thank you. Another question, which I think a lot of moms panic about. Are teeth a part of a milestone? Because I've got friends with 1-year-olds that don't have a single tooth. And then I've got one friend, and I mean, this is shuddering to think, especially breastfeeding wise, a friend whose baby was born with a tooth. So are teeth milestones or not?
So look, obviously we want teeth, because you can't eat and chew and start solids. You can, but, you know, going forward long term, that's going to be a problem if you don't have teeth. So now I've only heard of one case, and I wasn't involved, and I only heard of it, that was congenitally didn't have any teeth at all. You get the odd person who might be born and has the odd tooth missing. And funny enough, I also had someone who was born with a milk tooth, you know. So teething can be from day one. Generally, teething starts about 6 months. I've had earlier as well, 3 to 4 months. And I always remember the one story you gave a similar scenario. Now, you know, the mom came in and said, no, her kid's teething at 4 months. And I said, look, you know, they're also discovering their hands, and they, you know, it's neurodevelopmental. They're linking all the various wiring in the brain, all the links in the brain to learn where their body is. Oh, she was very indignant. Look, I know when my kid's teething, this kid's teething. Anyway, that kid got his first tooth at 19 months. And the kid probably was teething, but it was taking 19 months to come through.
Right, so it's all happening in the gums.
Normal. Don't get neurotic. You know, and if you're worried if there aren't teeth, look, it's very rare not to have any teeth. That's a very serious problem, and it's extremely rare. But the teeth are coming. If you're not sure, see your doctor or your nursing sister at your clinic, your dentist, you know, let them pass a comment. I haven't seen, I think the latest I had for a first tooth in my practice was about 20 months. So be patient. They come. As long as they eat, they chew, they swallow. And you know what? The little kids, when they're chewing with their gums, they're not actually chewing with the gums only. There are teeth under those gums. So that's why they're able to still chew solid food and still go on to solids even if they don't have teeth.
Shailene wants to know, when do babies generally start saying their first words?
So, yeah, it's probably sooner than the parents think. So another little example, I was at one of it was actually a family wedding. And this little kid was sitting in the passageway where everybody was walking past, and it was 6 months old. And every time someone walked past, the kid said, ayo, ayo. And that obviously to me was the kid saying hello to everybody, and nobody greeted the kid back. And I said, "Are you guys going to start greeting you?" They thought I was crazy. But it's any time between 6 months and a year when the kids start learning to speak. And generally, the first thing they often do is start imitating the parents' mouths, and that they might even do from 3 to 6 months. And then they might start saying single little bits of words. So they might start going ba and da and ga. And then they combine it, and they can't combine it into a single word, so they'll go da 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 and ba 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 ba, and then they'll.
Which Dad will definitely claim.
Yeah, yeah. I've got a theory about that. It's a long story.
So in other words, what you're saying,
I decided that was his name, because Dada and Baba are usually the first words, and then Mama's a lot more difficult, but Mom's done a lot of harder work, so she needs a more difficult name, and so Mama comes later on. And also the other thing I'm passionate about, I think that babies find that the less they use the word Mama, the more the mother pays attention to them. So they just throw them out, the odd little Mama, just to tag them along, I'm sure.
That's so funny.
It's
so
just
I love that they start mimicking you. So in other words, start getting a swear jar out. No, I'm just joking. Just
well, they learn all the words that they're exposed to, and even if they're not. So anything that rhymes, they learn, so they'll start making sounds of words that rhyme, and whether they swear words or not, they're going to learn them. And it's for us to teach them, hang on, these are acceptable and these aren't acceptable. But
I want to carry on having a look at some of the things that came through. My 3-month-old loves sucking on her fist. First time mom, not sure if it's normal.
So that's totally normal, and that's exactly what we said. So when they first born, they use their mouth to experience the breast and to learn the taste of breast milk and so on, and then they use their mouth to discover their hands. Now, if you look at a drawing that represents how sensitive a body organs are, the mouth is the most sensitive organ in the body. So it's this huge thing if you represent it just saying how many nerves are in the mouth. So they discover the world around them using the mouth after they've learned to feed. So they put their hands in their mouth, they chew, they swallow. And then, as I said earlier on, they then discover their feet. They grab their feet and they put their feet in their mouth. So that's all a normal developmental stage. And sometimes they are teething as well. So sometimes they are biting because their teeth are sore and they're trying to get them to come through. But by far the majority is discovering their hands, which is a totally normal thing. And also not to discourage them to do that, because, it's not socially acceptable for a parent to walk around with their hands in their mouth and so on. So that we can teach the kids once they've discovered their hands and feet. So you don't start discouraging that process. I think, parents want them to act like adults. Well, no, we don't want them to act like adults. We want them to act like kids so that when they get to the adult phase, we can teach them what is socially acceptable and what isn't.
Awesome. There's another message that came in here. She says, how do I get rid of the rash that forms around the mouth when they start drooling a lot? His cheeks are always dry with small pimples.
So yeah, there are very good barrier creams that one can put on. I find the kids who battle the most with that are the kids who have a pacifier or a dummy. Because then the saliva is between the pacifier and the skin. And then the acid from the saliva then just burns the skin. So good barrier creams, good thick barrier creams, on the lines of something like petroleum jelly. And every company is going to sell you what's good for, they'll have a similar cream. But at the end of the day, a good thick barrier cream similar to petroleum jelly. And there are those that just don't settle. So those you might actually have to put an anti-inflammatory cream that we use for eczema, and that your doctor would decide which one he feels best to use. I like the ones that maybe don't have cortisone in them to start with, but some kids react to those, and then you're left with no option, and you might have to have a mild cortisone cream, which is safe. We always choose what's safe for kids, Can't be giving kids stuff that isn't safe.
This is a fantastic question, and it's one that I want to know because we are raising a multilingual boys. But Amy here says, does multilingualism affect when children start speaking? So if we mix Zulu and English at home, does it cause confusion and delay in speech development?
So having multiple languages in a family can delay it because they've got to figure out, the various languages. And I think one's also got to be careful. So in my family, we had 4 languages, and it was just too much
Wow.
for them. It's just too much. I think 2 languages, and the one language should be one of the South African, one of the 11 official languages. And the second one, I think, even by law in my mind, should be whatever the second language is of the family. Because, I mean, in my family, it's Italian, but my kids don't speak it because they had to speak 3 other languages at school.
Right.
So my kids don't, unfortunately, speak Italian. They sort of have an ear for it, but they don't speak it. But if you have multiple languages in a family, it can slow them down. But it doesn't mean that they won't learn the languages. And I think the trick when it comes to languages is not to mix the languages. So what happens is people might mix. It's a bit like when you're speaking trendy Afrikaans. Half of the words are Afrikaans, half of them are English, half of them are mixed, half of them are Brak. So when you speak languages, keep it to one language. So ideally, the mother should speak, or the primary caregiver, because it's not always a mother, it might be a father who's the primary caregiver, should speak the language that they're going to be educated in. Then the second language can be either the other parent, or in South Africa, often it's other people, domestic workers, gardeners, and so on. So yeah, I'd encourage it. I mean, I did have the one kid who spoke 4 languages fluently, but then they obviously were gifted that way. So if you've got a kid who's gifted and can speak 4 languages, go for it. Even if it delays language, because the more languages the better I think it is for you. But don't make it that it's tripping the kids up, and that it's a pressure. So I kept trying with my kids with the Italian, and I tried, and eventually I thought, you know what? I work hard. I work 24/7. I get called out at a moment's notice. When I'm with them, I've actually got to share time with them. So I just spoke to them in English eventually, and it's just the way it is, If they want to learn Italian later in life, well, they can go to school and learn how to do it, It's not a train smash if they don't pick up the second language.
Okay, we've got 2 more questions. For premature babies, does it mean that they are going to be late in their milestone development?
Yes, that certainly is the case. So, in the first few months, one's got to correct their milestones for their age, but they do start catching up, funnily enough. So generally, anytime between 12 and 18, or maybe even 24 months, that prem baby will catch up. But one of the sad realities is, that when we choose when kids go to school, they don't take the prematurity into consideration. So now you got this kid who is a little bit, would be normally a bit slower, not because there's any impediment, but because the kid was born. And so when they compete at sport, they might struggle with that. And that is, I think in time they'll probably deal with that problem. But you do have to give them a bit of leeway. But by 2 years, we'd like them to more or less be at the 2-year milestones. I think if there's severe...
And the last question. Okay.
Yeah, so if there's
the last question that we have today is what happens if a baby is a few kilograms underweight? Should we still seek help if the milestones are achieved?
So everybody's got a different body form, and we have the growth charts. That's the importance of the growth charts. I mean, the growth charts were a major development in following up pediatrics and following children, because now we can compare them to the rest of the population group. And everyone is different, and I think often looking at the parents, it can be helpful, and they don't always follow the growth pattern of the parents. But what happens when you plot the growth charts is you've got to see where do they fall on the various percentiles. So if this child was born with height on the 90th percentile and the weight on the 10th percentile, and they keep following those percentiles, and they're growing, and they're developing, and they're eating, and they're drinking, well, maybe that's not a problem. The problem arises when the baby doesn't make the percentile. So say the kid was on the 90th percentile and the weight was on the 50th, And the next time you do a checkup, the height's still on the 90th, but the weight's on the 25th. Then they come for another checkup, and now the weight's on the 10th percentile. At that point, you've got to look at it, you know. And look, fortunately, most of these kids, it's nutritional. So sometimes just a bit of nutritional advice, and then the kids catch up and they go back to where the milestones where they were. Sorry, I mean, not milestones, the growth percentiles.
Right.
Yeah, if you keep falling off the percentiles, that's when you've got to start acting, and don't ignore it. If it's an established growth pattern, going well, hunky-dory, no problem. But if the percentiles aren't maintained, one's got to look at it.
Well, Dr. Maraschin, that is all the time that we have time for today. But I just want to say thank you so much for your incredible knowledge. Thank you for doing such beautiful work in taking care of our babies and our children. And if anyone wants or needs a pediatrician, I think you found the perfect man to go to. He has his private practice at the Morningside Clinic. And it was so lovely to officially meet you. And again, thank you so much for your amazing expertise.
Thank you. It's been great, and I really would like to thank you and Mama Magic for inviting me on the program. It's been great to share information, and yeah, when we're dealing with our kids, we're dealing with the future, and you can't mess with the future.
Absolutely. And I just, before we end off, want to say thank you again to Mama Magic for having the both of us, and also that you can join in the Mama Magic celebration weekend activities. They're having this fantastic weekend, and it's all happening on their website, which is www.mamamagic.co.za. So from the good Dr. Maraschin and myself, Bailey Schneider, thank you so very much for tuning in, and we hope that we answered as many of your questions as possible. Sending you guys lots of love, and this will be an IGTV video if you need to come back to any questions. Thanks again. Bye.
Cheers, Bailey. Bye.